Welcome to the MamasteFit Podcast Birth Story Fridays. On this episode, we have Abha, who's going to be sharing her hospital VBAC story with an epidural, where she had an induction, but with a very supportive provider at 41 weeks that she switched to at 28 weeks in her pregnancy.
Welcome to the MamasteFit Podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit Podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We are glad to have you with us on this journey and that you have chosen us to support you.
Welcome to the MamasteFit Podcast Birth Story Fridays. On today's episode, we have Abha, who's going to be sharing her VBAC birth story. Thank you so much for being here.
Thank you for having me. I'm so excited, and this is going to be so fun. Feel like I manifested this, and here I am with you guys. So yay!
I'm so excited. So tell us, Abha, how did you prepare for pregnancy and birth?
Yeah, so this is my second birth. I gave birth about a year ago. My daughter just turned a year last month, and in her birth is where I used your work a good bit to get me going. Prior to my son, who's now 6, I had him in 2018. During his few years before I got pregnant with my daughter, I used to get a lot of your content and come across a lot of your work on Instagram, and I used to share it with a lot of my patients. Just as a background, I am a prenatal chiropractor in Atlanta, and
nice.
I would love just sharing the information, learning the little tidbits, and helping patients with your content and letting them know that there's a great resource. I don't have to do the work; someone else has done it. So similarly, when it was my turn to go through the pregnancy round 2, I ended up signing up for a VBAC course originally. And then I also went down the rabbit hole of yoga and birth prep work for the actual birth, because this pregnancy I was, hoping to successfully achieve a VBAC after having a non-emergent C-section first round. And it wasn't until about 28 weeks during my second pregnancy that I finally just pulled the trigger and switched providers and ended up going kind of full force VBAC prep mode. And so that's where MamasteFit came in handy a lot. And it was nice to be on the flip side and actually be a receiving recipient and patient of the work. And I can't recommend it enough. I mean, after giving birth, I ended up doing the return to postpartum fitness as well.
Yeah, I'm glad that we could be a little bit of your birth prep and that you recommend us to your patients. That's such an honor.
All the time.
That's awesome. So how was the end of your pregnancy?
So thank goodness, I ended up achieving a VBAC as planned. Thankfully it was definitely the most surreal, empowering moment, redemptive in a lot of ways. It was an absolutely beautiful birth, all said and done. I did go over the 40-week mark. I ended up delivering at 41 weeks one day. And my son 5 years ago was 42 weeks in one day. So a huge component was just trusting my body in that moment and kind of having a very supportive provider and team in place that, prepared a game plan at 38 weeks, 39 weeks, 40 weeks, and 41 weeks, which was kind of our cutoff. And I think what I learned from my first birth going into my second birth was that we can do all the planning we want, but ultimately what ends up happening in the moment, for the safety of you and your child is what will be done. And so this round, even though in the back of my mind, I knew I had done everything in my power to prepare for this birth the best way I could. And if it was meant to be for this baby girl to come through vaginally, then great. And if not, it is what it is, as long as we come out on the other end super healthy and happy. So
tell us, so you went into labor at 40 weeks. So tell us the labor and birth story.
Yes. So my labor actually wasn't until 41 weeks. And then, as I mentioned before, I switched providers at 28 weeks with somebody. If you're in Atlanta and you're familiar with the birthing community here, there's only a handful of really good, supportive VBAC providers that are both tolerant and, in fact, supportive. So I switched providers, which means I switched hospitals, and basically started at 28 weeks onwards with them. And maybe because I had the knowledge prior to of my own birth and just based what I'm able to do on a daily basis with my patients, I knew that there was a higher chance I would be a good candidate for a VBAC. And so that's why I felt okay kind of advocating for myself and switching providers and coming up with a game plan that would be favorable. Had there been any risks associated, I may have not considered it, but both of my pregnancies were very textbook. I stayed pretty active during the whole thing, had, barely any health issues, blood pressure was good, all that good stuff. Thankfully, it was very textbook. And so my provider and I had agreed on doing no cervical checks either during this pregnancy until close to 40 weeks. And that 40-week check would be either a membrane sweep or a cervical check just to kind of assess where we're at. Given that my prior pregnancy at 41 weeks, I was just closed shut and there was no, hope coming my way at all. And there was never a forced induction conversation, or there was never a force of this does not look favorable for you. I think we should just go down the surgical path right off the bat. It was always a very supportive conversation. Like at 36 weeks, we're going to start the primrose oil. At 37 weeks, we're going to start the 6 to 8 dates a day. And my provider trusted me enough to make sure I was doing the things necessary to anatomically get my body ready, and like my pelvic anatomy and all the good things, keeping my hip flexors opened up, literally preparing my birth prep as if this was already just going to be a vaginal birth, like no questions asked. And so I spent a lot of time just kind of walking, strength training, doing a lot of hip opening moves, probably right up until 40 weeks. And then 39 and a half weeks, and 39 and a half weeks to 41 weeks, I think I just walked a lot and did curb walking a lot. I just walked and walked and walked and listened to a lot of podcasts and just got my mind right and stayed in a good mental space, while not forgetting that this could also go the exact opposite way. And that's also okay if that, ends up happening.
Yeah.
But, and I don't know if it was the usage of primrose oil or intentionally and mindfully moving my body in the way that it was meant to move versus, trusting the nature's process and magically the baby would just fall out, because that obviously did not happen in the first round,
Yeah.
So I think the preparation and having the guidance and reassurance constantly from my provider and from my husband, and just kind of surrounding myself with the right content or mindset brought me where it did. And then, so I did end up having a cervical check at 40 weeks, aka like a quick membrane sweep. And the membrane sweep was possible because my body felt ready for it. So it wasn't uncomfortable. I also just kept in mind how to breathe through the process, from your course and the content, and how to allow the cervical or the membrane sweep to happen. And that happened at like 40 weeks plus 3 days ish. And that within the 24 to 48 hours after that visit, I started, some things started to stir, and there was some movement or some, kind of some loss of mucus plug. And I pretty sure I messaged my provider by the hour, what is this? What is this? What does this look like? She's like, you've done this before. I'm like, I know, but I actually have never witnessed going into labor before, so a lot of times we feel like, okay, well, we're going to be second and third time mothers. We know, been there, done that. But if this is a birth that's going to look completely different from your first birth, you actually don't know what it's going to look like. And more than likely, it's going to be brand new all over again. So a lot of this was brand new all over again. And then our game plan was come 41 weeks. That was kind of like our cutoff, and my weekly dates were on a Friday anyway. So our plan was on 41 weeks, we would go in, just do another ultrasound to make sure, fluid levels were good, growth levels were still looking good, and there wasn't like a risk in any areas. As long as we got an okay on the ultrasound, my provider would recheck me, and we would just then come up with a game plan like, can I get a mild induction, or am I in fact dilated where this could, progress somewhere in my favor? Or are we now just talking surgery within 2 to 3 days, given that it was the weekend? And so something in that morning, because I knew I was going for my ultrasound check, I dropped my son off to school. I saw him walk down the hallway, and I called him back to give him a really tight hug. And somewhere in my mind, I knew I wasn't gonna see him that night. That I think I was gonna stay put at the hospital. It was very weird. It was like 8 a.m. and
your intuition.
Yeah, you think about this gut instinct, intuition. And I remember walking back with my husband to the car, and I was like, I don't think we're gonna see him, and I think we're gonna see him next to the baby. And he's like, you're crazy. Like, let's just get to the hospital. Let's get to the doctor's office.
Yeah.
We'll deal with it then. And we had brought our hospital bag anyway, just because the hospital that I switched over to was about 40 minutes away. And so my provider's office in the hospital is around the corner. And so she had said, like, bring your stuff just in case it looks like things are progressing, or if the ultrasound looks like there's, something terrible or not favorable. At least we're right there, and we don't have to worry about you driving back. And if you're from Atlanta, the traffic here is a nightmare.
Oh, it's awful.
So many levels. And so we had our stuff with us. So we went and got our ultrasound. And then sure enough, she was like, yeah, you're about 3.5 centimeters dilated. The membrane sweep was favorable. And while I'm checking, I'm able to move things a little bit more. And so I was like, oh, okay. This was at like 9:30 in the morning. And she's like, I'll tell you what, like, nothing will change today versus, and this was on a Friday. So she's like, nothing will change today versus on a Monday, like 2 days from now. My suggestion is we get this show on the road. Let's get you in the hospital. Let's get you checked in. Let's get you settled in. And we'll just start with like a very, very mild induction of a Foley bulb, and then like as low dosage of Pitocin as needed, if at all. And then we'll just take it from there. But I'm pretty sure you're going to have a baby today. And I was like floored. I'm like, what? Like, so, like, talk about intuition. Somewhere deep down in my belly, I'm like, any minute someone's going to tell me like, nope, we're just going to go do a C-section again because your body's just not ready for it. Because like it's what I was told in the beginning stages that no, once a C-section, always a C-section, your body is going to not be favorable. There's a super high risk of uterine rupture and so on. And so when we heard that, we're like, okay, cool. Yeah, like we're going to go to the hospital. And so she gave us a couple of hours to just go like grab a coffee and get something to eat, because it would be a while before we would eat again, especially like as, labor would progress. And so around 12:31 p.m., so fast forward a few hours, we got into the hospital, checked in, got settled in. They like hooked me up to the IV setup and got the Foley bulb attached, which was a very interesting experience also, because I had never had that before. I had learned about it in my boot camp or my birth boot camp classes, but Foley bulb was favorable within a few hours, not even, maybe 3 hours. The bulb popped out, meaning that it brought me closer to like 6.5 centimeters, 6 to 7 centimeters, which was great. The labor, like during that time, and the contractions during that time were extremely, extremely painful. And I remember with my son's birth, I probably labored for about 18 hours before I gave in with the epidural. And I labored that entire time with pretty high dosage of Pitocin. So in my mind, I kept reminding myself, like, you've done it worse. It was way worse. At least it's your body's natural, response to the waves that it's bringing to you, which means one more wave is one step closer to the baby. And so you can do this, you can do this. And it was pretty rough. It was pretty rough. There were a lot of times I'm like, I'm just going to throw up, and I just want to be done. Like, I can't do this anymore. Once the Foley bulb popped out, we kept laboring a little bit longer and did all the things, right? Like during my first birth, I had a doula, and I still remembered a lot of stuff because I like share a lot of that stuff with my patients. So through your courses, I learned a lot of things. So I'm just doing all the things, but in the moment, in the thick of it, your brain just like stops and you're not remembering anything because you're just trying to like work through the amount of pain that you're, experiencing.
Yeah.
And so thankfully my husband, I joke now, and like my birth team jokes now, like he was like the best husband doula I could ask for, because
Yeah.
he remembers the flip side of things with a different perspective. And so he was super encouraging and super, like, you got this, like, let's go be on the toilet backwards. That might just help descend the baby a little bit more. We don't want like a asynclitic position, because that's what happened with my son. And so it was very encouraging to have like an extra set of hands that was so familiar with a lot of things, who typically isn't familiar with anything female related. So that was really nice.
That's awesome.
Which is great. And my provider, and she was at the time training a new midwife to join her team. And I like count my lucky stars, because I essentially was able to give birth with two phenomenal, midwives. And so they kept checking in every 20 minutes and like, assisting in whatever I needed. Eventually around like 7.5, 8 centimeters, when like things got very intense and very heated, we had the conversation of getting an epidural. And I kind of got like a window, like, if you want to get it, like, this is the time, because after this, things are going to progress, because they already are. And I ended up getting the epidural. Somewhere in my gut instinct, I kept thinking, like, while things are happening and we're progressing and the baby's good, heart rate's good, there's a very strong chance I'm going to get wheeled into the surgical room anytime. So at least I already have the epidural. Like, I just had like such terrible flashbacks coming to my body over and over again, while trying to stay sane and like,
Yeah.
think of the bigger picture and think of the bigger perspective here. So anyway, we agreed on the epidural. Of course, anyone who knows who's gotten an epidural, once you agree, magically it takes like an hour before you can actually get it.
Oh, yeah.
Like,
Yeah. Now you're like, I do want it though. Like,
yeah. I'm like, I do want it. I just would like it like now, instead of waiting like this IV bag to run out, or like another 45 minutes to an hour. So to me, it felt like an eternity. And ended up getting the epidural. I do remember it being more painful this round than the first round, for sure. Maybe because I had gone so long that I wasn't going to get it. And then the provider, the anesthesiologist who came to give the epidural, is chatting up a storm about like patients and practices and like all of this fun stuff. And all I can think about is, I'm trying not to throw up on someone's face, because this is so uncomfortable on so many levels. The goal of the epidural,
not
right?
the time.
Yeah. Each time the goal of the epidural was really just like, get some rest. Hopefully it helps the baby progress and like lets my body just like chill out for a minute. Because at this point, over the last 3 days since my first cervical check, or the membrane sweep, I hadn't slept a whole lot anyway, just because like, I was a little anxious, a lot of the fear of the unknown. So the goal was just like, chill out for a little bit, lay down, let like your body do its thing, and then it'll be go time again. And 2 hours is about 2 hours, I would say. I got my epidural around like 7 p.m., 7:30, I would say. And then around 9:30-ish, my providers came to check. It was close to 10, I would say. My providers came to check 10 at night, and she's checking and things are progressing. And she's like, "You're complete. It's time to push." And I literally like came out of like a coma almost. I'm like, "What did you just say? What? Like, what?" And so to me, those
You're
words,
like, what do you mean?
yeah, like those words, like I was expecting like, nope, you're still sitting at about 7 centimeters. Like, things have not progressed. Again, talking about flashback from my last birth, there was, I think I was on an epidural for about 6 hours, and my station just did not budge. I stayed at -1 for like 5 or 6 hours. And so in my mind, I was like, what do you mean? What do you mean? It's, what do you mean we're ready to push? So music to my ears, of course. And I think the first thing I said to her, I was like, I don't know how to push. Like, everything I feel like I learned or like spend time learning, I don't know how to push. And she's like, don't worry, like, we got you. We'll walk you through all of it. And the same concept, right? Like, second time mom, you would think but if you haven't got to experience that first round or first birth pushing or even laboring, all of this is super new. So my providers, both of them, and a couple of nurses came in, coached me through like how to go about pushing. And I just spent like some time to like remember all the things I had learned, both from MamasteFit and a lot of my like birth prep courses. I think we pushed for maybe like 20 minutes, 25 minutes or so. And my husband got to deliver my baby girl, which was incredible. It was so cool. And it was really like my epidural was very tapered off. I don't think I ever increased it at all, like from the time I got it. So it was the same dosage the entire time. So during the pushing stage, I like felt a lot of everything, minus like the excruciating pain, but I felt like the sensation of like my body opening up or pushing the baby down or pushing it down, descending down the canal.
Yeah.
So that was really great because I understood what it means to be in sync with your body and allowing it to do its, job that it's meant to do. And we ended up literally, I'd be like, okay, like before like the monitor even showed like, a peak of contraction, I already would say like, I think I'm ready. Like I'm ready for the next round or I'm ready. It's coming on. And, even with my epidural, they allowed me to kind of move a little bit, during the pushing stage, which was really great. I ended up getting like that T-bar and really allowing my body to get like a deep squat, which was awesome.
Yeah.
It was just like the most surreal experience ever, especially when like you've been told that I just don't think your pelvis could handle the movement of the baby's head descending down, or there's a reason why the station didn't budge because your like anatomy is XYZ or your pelvic is, torsioned a certain way.
Yeah.
And for someone who does this for a living, I find that hard to believe because literally I've like helped patients get to the other side for that very reason. And to have that be on me felt like a huge, sense of failure and sense of like unaccomplishment. So to go experience it where it is favorable because, now you've intentionally put in the work and, are really prepared in more ways than you ever were was just like the most beautiful thing ever.
That's amazing. So it sounds like you picked the perfect kind of birth team with your provider. And then as well as your husband was so supportive and helpful for you.
Yeah.
During your entire labor. So did you end up needing Pitocin at all, or was the
I think
Pitocin?
we ended up doing a very, very low dosage of Pitocin, like the bare minimum. And it tapered off pretty quick. Like it wasn't for too
They were able
long.
to turn it off.
Yeah.
That's awesome. So your body did it.
Yeah, but which was really cool. And like I think she said that like usually when the Foley bulb ends up being favorable, that means that your body's already kind of getting, warmed up to what's to come. So that was super helpful.
Yeah.
Had that not been the case, maybe the conversation would have been a little bit different. But it was a very, very cool experience. And just I like to your point, like having that birth team, I think the reassuring component was that I knew it would be either one or two midwives, and that's it. There wouldn't be like any guess of here's a team of 10 providers. We don't know who's going to be at your birth.
Yeah.
And like here's, one visit to meet them and hope that, things work out well. Which was the issue with my last provider, which I had adored and loved my last provider. But like, I understand it's a very medical heavy office. Therefore they can't guarantee who, you're going to get unless you have something scheduled ready to go or an induction date ready to go.
Yeah.
And so, I like talk about this often now with like friends who are attempting this or like patients, or I talk to my husband. The magic happened for me by getting an extra week in this pregnancy, right? Because before, had I stayed with my original provider or many other providers that are with similar views on, attempting VBACs or a TOLAC, they needed me to have a date on the schedule right before 40 weeks. So 39 and a half weeks was my cutoff. And I just never understood that. I'm like, what difference will like 48 hours really make if there's nothing physically wrong with me or the baby? Well, like nobody could answer that. And by no means was I like challenging them in any way in their like system of education and what they do on a daily basis. But I generally just didn't understand why 39 and a half weeks and why not 40 and 2 days? Because what if someone actually genuinely went into labor in those 2 extra days? Like, don't you deserve to experience that or allow your body to experience that?
Yeah.
Yeah. So having that extra week, given that my first birth was at 42 weeks, a little over 42 weeks in 1 day, and this one was a whole week over, I know my body does not produce babies before their due date. And we all know that due date is exactly that. It's an estimated week. We just don't know when it's going to happen.
Exactly.
Right?
That's amazing. So I I loved your story. And I think it also brings to like that, like, yes, you had a C-section with your last baby, but
Yeah,
like no one can say like, oh, you can't have babies vaginally.
that's
Like
exactly it.
that's not in the cards for you if you've never given the chance to try.
Yeah.
Because there's so many people who can still have a vaginal birth. Like maybe something was off with the first baby's position. There's so many things that could be
There's
like
so many things
going on. Yeah.
Exactly.
That it's hard for someone to be like, oh, yeah, your pelvis is too small. Like that's a pretty definitive statement to tell someone. And then like even you who super educated in like the pelvis, like this is like one of the things you do with your job is like aligning people's pelvises. Like if someone tells you something like, oh, no, you can't do it. Like you couldn't do it last time, so you can't do it this time.
Can't do it at
You
all.
know that you know the body,
Yeah.
but like that like seed of doubt can still grow. And then even during your birth, it like kind of came up a little bit.
Yes.
Where like that little plant was like, oh, can you still do this? Like, no, I'm going to get an epidural because there's still a chance. Like they can roll me down to the OR at any point. This can go wrong at any point. When like it was going beautifully for you.
What is interesting is that there's nothing wrong with the C-section, right? Like,
No,
thank
not at
God
all.
that there's modern medicine available and there's skilled providers who do beautiful surgical work. Some women prefer it for whatever reason. Some who generally emergently need it. And that option exists. Like, how wonderful is that? But like telling somebody that this is one all, done all, and then there is no other way around it, I think is a little absurd. And don't get me wrong, like with the new provider and the new hospital that I switched to, I did meet with like their main OB surgeon at an appointment during my midwife's appointment, and that's routine. And I like signed off paperwork saying that yes, I am signing off on the risk that I could die, right? Like yes, there is a chance of uterine rupture, but there's also a chance of plethora of other issues that can pop up that we're not even discussing. But if you know anything about birth, literally anything can go down.
Yeah.
Like knowing your risks and knowing the likelihood and chances of your success rate versus being told that, nope, it's just not going to go down, I think are two very different things, right? Like,
yes.
The two things I learned out of this whole thing was like really like advocating for yourself and doing the due diligence and doing the research and interviewing the providers and spending the time, outside of like your provider's office or outside of your own space to put the time into your body because you deserve it, right? Not only for like the birth experience you're desiring, but also for like, what does recovery look like going forward for you?
Yes, exactly.
I thankfully had a pretty good recovery with my C-section. I had a pretty good recovery with my vaginal birth. I had no tears whatsoever with my vaginal birth. But I still trickle a little when I'm, doing jump rope. Like, that's just the reality of things, right? But you put in the work and then you question within reason, what does your success look like in here? Instead of just being told outright that like, nope, it's just not going to work.
It's like you were given the choice, which is such an important thing.
Yeah.
And it's such an empowering thing to be able to have made that choice for yourself.
Absolutely.
Like, yes, some people are given the choice of C-section and VBAC and they choose C-section. And that is amazing and empowering because you made the choice. But it's when someone's like, no, like you shouldn't even try because your body can't do it. So we're just scheduling your C-section. That's when it's like,
that's a huge thing.
Give them the choice to do that because you don't know if their body can't have a vaginal birth.
You're never going to know until you give that opportunity to somebody,
exactly.
Right? Like I knew that I did not want to experience the kind of postpartum within minutes of giving birth to my son and not seeing him for an hour and 25 minutes this round. Like I knew that I did not want that. If I had the option of doing it any other way, 100%, I'd want the baby on my chest immediately and get that golden hour. And not only did I get a golden hour, I got 4 golden hours. Nobody came. Nobody bothered us. We still didn't know what we were doing, but we were just together.
Yeah.
And it was like, that alone was like healing in itself, like on so many levels.
Yeah.
And like, it is a huge sense of like advocacy that goes in at the same time as understanding that like, it's okay if you need to, leave a provider to go to a different one that might be a little bit more supportive of your goals. Because
Yes.
if you're already having a hard time having a conversation with a provider who's not on your team or who's not supportive, then that's a major red flag.
Yes. Yes.
You know?
And I think it's important to note that you can, granted, you're in Atlanta, so there's a lot more options for providers, but like the provider that's closest to you may not be the best provider for
That's
you.
exactly
So
it. Yeah.
being open-minded to potentially driving farther. Like we drove an hour for my birth
Yes.
to
Yeah.
a provider that is really supportive of just like unmedicated, low intervention pregnancy and birth versus like the one that's closer is not as supportive. So like knowing you have options potentially, you might have to travel a little bit further, but is that worth it to you as well? Like these are choices and options that are available to you that should be part of that consideration. So if someone was in your shoes, had a C-section with their past birth and now looking into a second birth, second pregnancy and navigating like that choice of the C-section or VBAC, what kind of questions did you think of that helped you decide which one you wanted to go with?
Yes. So when I decided that I was going to make the switch, I had a list of 3 providers that I was going to interview and or just call and get on a phone call with them and, pick their brain as best as I could. Thankfully, the first of the 3 providers is who worked with me well. And we kicked it off really well. And I felt heard, which was a huge component, number one. And I felt supported right off the bat. And I hadn't even met her in person. This was just a phone call. And the type of questions I asked was, if I broke down my entire first birth plan and birth story, where do I realistically, like if I was your daughter who was in this position, what would you advise me to do? Like, do I stay where I'm at and just, and to be fair, my original provider basically was like, if your body goes into natural labor before 40 weeks, 100%, we can just make this happen however your body allows. But if it doesn't, that by 39 weeks, a few days, we'll have to have a C-section on the schedule as a backup. So when I asked my new provider, I was like, if this was your daughter or if you were in my shoes, would you say, yes, let's give your body the chance to do this? Or sounds like there's too many risks associated. There's been like, I don't know, gestational diabetes, or there's been, like a lot of visits with like super high blood pressure, or there's always a risk associated. There's cholestasis, XYZ. I'm not going to risk it. Right. Thankfully, I did not have any of those factors. And like I said, it was a pretty textbook pregnancy that she said, yeah, like you're going to be a great candidate. You're going to be a phenomenal candidate. And yes, there's a risk of uterine rupture, but the risk is much less than, what someone might make you feel is the case. And I know that from the statistics on your VBAC course, right? Like I use that statistic quite often. The other question I asked her was, like if I were to end up in a C-section again and it happened in the hands of a new surgeon or at a new hospital, can I make the switch last minute and be like, I just want to go back to my old provider, So the way she broke that down for me was she goes, yeah, like no one can make you show up. Obviously, like if your provider is happy to take you back, go. Like that's cool. Number one. Number two, but she's like, if you've had a C-section prior to this, you like someone going in for a repeat C-section already has a blueprint on your body. So they're not doing anything different in terms of like a new scar or new anything. It's just going back where there's already a scar and redoing all the things all over again. And so that was a reassuring question for me because I was kind of paranoid about having like this big, huge abdominal surgery all over again. Given that I have a 5-year age gap between my kids, I spent a lot of time healing my scar tissue and like reworking on like, the cut of the 7 layers. And so I would ideally love to not have to go through that again. And so it was helpful to have these honest, open conversations. And I will say my experience going down a midwife team versus a traditional OB team was the abundance of time that I got, right? Like I also paid out of pocket for this. So that's another, benefit in that my insurance was not dictating anything. I ended up getting the service I wanted with scheduled 60 to 90-minute visits, have all the conversations and all the questions and concerns, and I was never rushed. The actual birth from the hospital was billed to my insurance, but having a very comfortable conversation every single visit with any concerns was so helpful. And I just was never rushed with anything. And it was always like, here's a list of pros, here's a list of cons. The pros are outweighing the cons. I think you're okay.
That's amazing. So I love that you had like the questions that you would ask your providers to find, and you felt confident in this decision by also knowing the statistics as well as like just like what you were wanting out of your birth. And I love that you had an empowering pregnancy and birth. And obviously we were like a tiny, tiny portion of it, but I'm glad that we were able to support you.
I loved it. It was so helpful. And I think I had an email from either Gina, or it might have been Gina or your team, asking like if I was done my postpartum like return to fitness. I'm like, no, I'm still using it. I definitely still use it like at random, especially if I'm traveling, because I can just pull it up on my iPad or my phone and like knock out a quick 30-minute workout. It's just been so useful. And I think that's like been very encouraging for patients or friends to let them know that like you have so much content on your Instagram or on your YouTube or, like your website that like, even if you don't want to go down the road of like paid courses yet, you can still learn so much. And like learning is ever evolving. And, in the case of like parenthood, motherhood, birth, like advocacy, you're forever a student because things are changing and evolving. And the more you know, the better you'll do, hopefully.
Yeah, I love that. Well, thank you, Abha, for coming on to the podcast and sharing your pregnancy and birth story and your tips for VBAC. Thank you so much. And I'm glad that we were able to support you.
I know. I'm so happy. Thank you so much. You guys I'm definitely like fangirling always over you guys. So I hope someday I can make it to where you guys are at and like do a training session or come see the facility and everything. So.
Yeah, we would love it. You're always welcome.
Yay. Thank you for having me. I appreciate it so much.
Hi, my name is Lakeisha Murphy Spencer. I am a certified nurse midwife in the Central Carolina area, and I recommend MamasteFit to so many of my patients because it's so important to get that functional fitness base in. They are amazing at explaining the physiology of different changes that happen in pregnancy, before, during, and after birth, and they are a great way to reconnect with your body and push yourself to a new level as a mom or a mom-to-be.
Thank you for listening to Abha's birth story, where she shared about her empowering VBAC. And she switched providers halfway through her pregnancy, and knowing that that's an option and is such an important option that we can switch to a more supportive provider for the birth choices, whether it is a C-section or a VBAC or an epidural, but they are supportive of the choices that you're wanting for your birth and allow you to make the choices yourself rather than telling you what they're going to do. By Abha switching to a more supportive VBAC-friendly provider, she was given the choice to be able to go for a VBAC, wait till she was 41 weeks, and given the option to get those membrane strips and be able to make the choices throughout her induction process and birth. And this made this experience so much more empowering for her versus her provider only giving her to 39 and a half weeks to go into labor, even though she has a history of going to 42 weeks. This experience would have been a little bit different than the experience that she was able to achieve by switching providers. And Abha shared some really great questions that you can ask your providers to see if they're a good fit, because not every provider is going to be a fit for everybody. We have different personalities, and so finding a provider that not just supports you, but also jives with your personality can be really beneficial. If you enjoyed this episode, please like and subscribe to our podcast so you can be notified whenever we release new ones. We release new educational episodes every Wednesday and birth stories every other Friday. And if you're pregnant and looking for more support, we have an online childbirth education course where we break down the science of labor and birth to take away some of the mystery and make it less scary. We discuss birth options as well as how your partner can support you, different things to expect in the hospital birth, as well as a little bit of out-of-hospital birth. We discuss a little bit of postpartum care, but we also have an entire course on what to expect in the postpartum for both you and baby to help you prepare, because postpartum is sometimes forgotten about. We also offer prenatal and postpartum fitness courses. Our prenatal fitness is offered in 2 formats, our Team Builder app and an on-demand program. Our Team Builder app is available in a full-length and a mini program. This is an app-based program where we have a list of exercises with demo videos that you work through at your own pace. The full program takes between 45 to 75 minutes, and then the mini program can take 15 to 20 minutes. Our on-demand program is a video that you watch and work out along with us, and we have different trimesters, so first, second, and third trimester on-demand videos. And we also have postpartum fitness programs available in the same options of the Team Builder app or an on-demand. And you can check out all of our offerings at MamasteFit.com and use code YouTube10 to get 10% off any of our offerings.